Hello and welcome to our fourth Health on the Plains coffee hour. Thank you all for being here. Today is our fourth session, and we'll continue for one more month. On the last Wednesday of the month, I will spend an hour with you all, with a great leader in public health and in rural health and rural communities, and I will be supported by my trusty cup of coffee. Now we know this time doesn't work for everyone. We're happy it works for you, but this session is being recorded so that we can share it with folks that can't join today. If you're new to this coffee hour series, my name is Wyatt Beckman, and I'm a senior analyst and portfolio strategist at the Kansas Health Institute. The Kansas Health Institute is a nonprofit, nonpartisan educational organization. We're based in Topeka, Kansas. We believe that evidence-based information, objective analysis, and civil dialogue can inform and support effective policies, programs, and interventions for healthier communities. This series is built on the idea that nuanced conversations with thoughtful people, like the one we're going to have today, can help us better understand the many factors that shape rural health and rural well-being. With that better understanding, we can all work to envision and implement more effective strategies with and in our rural communities. Oftentimes, I find these conversations are best guided by a good question. And today that question is this: how can we bridge the gap between community identified needs and those available resources that we know are out there? And today, we're really excited to have Kjestine Woods. She's a program officer for LISC's National Health Program. She focuses on managing grants, partnerships, and program implementation, and has experience in grant making, healthcare services, government relations, and grassroots advocacy in nonprofit and for-profit organizations. Before LISC, Kjestine worked in cancer prevention in Illinois and Washington, D.C. She focused on research funding, health education, advocacy, and patient services. Last bit of Kjestine's introduction here. She is a certified health education specialist. She is a returned public health Peace Corps volunteer and is the co-director for the Colorado Public Health Association's Public Health in the Rockies Conference. She has a bachelor's in health promotion and fine arts minor from Purdue University and a master's of science in healthcare administration and strategic leadership from the University of Denver. She grew up in rural New Mexico and Indiana, and she currently resides in our neighbor state to the west out in Colorado. Kjestine, we're really excited to have you here.
I'm so happy to be here. As some said, first time speaker, long time listener, and so happy to be here.
Well, thanks for being here, Kjestine. Let's dive right into something that I think is a key piece of your work, but is an aspect that maybe is unique for a lot of us that come from a healthcare or public health background, as you do. And you're still very active in that world. You know, you're involved with Colorado Public Health Association, but you now work for LISC, which is a community development financial institution, better known as a CDFI. I imagine there are folks listening that honestly are not too familiar with what a CDFI is. And even those among us that know the acronym, we might not really be able to see the connection between a CDFI and health efforts. So give us some foundational background, especially those for us that are coming from public health and healthcare. What is a CDFI? How can CDFIs be a tool in our toolbox, our collective toolbox for advancing health?
Yeah, thanks, Wyatt. That's a great question, and you pointed out my background in education and public health and healthcare didn't really cross paths with finance and economic development all that much, but I learned something new every day. And in general, CDFIs they're, like you said, community development finance institutions. There's about 1,400 in the US, and they were established in response to areas of our country, both urban and rural, that were underinvested or disinvested communities. There was a push to really provide financial services due to this, inefficiency, um, or inability to access capital and access the support in the financial aspects. So I think it was around the 60s and 70s that there were community organizations that really started focusing on this. LISC was established in 1979, and really our focus was around housing, affordable housing, and it's evolved. So CDFIs, like I said, seek to address the financial needs of under-resourced communities. There's been a real focus, and I think the missions of most CDFIs are really revitalizing and economic development, community development. I mean, that's LISC's primary focus, is really serving people in places that have historically been underinvested in. And we do this through a myriad of resources and tools, through lending, through capital grants, through loans, through equity investments, technical assistance, capacity building. So CDFIs really fill this niche in our nation's financial services that that other lenders and kind of the conventional banking just hasn't. And the ultimate goal is really to bring people into the economy and as homeowners, as entrepreneurs, as small business owners. That said, I'll also add that, coming from the health background, the social determinants of health are fascinating to me. I went to school hoping to find solutions. I think I found even more challenges. And the social determinants or social drivers, or what term you use, is really what LISC addresses. So much of it: housing, employment, transportation, childcare, financial stability, all of these things that I was curious about how are they working, or how are they maybe not quite working, and how to really get at the ground level of changing that and helping people in communities not just have better wealth but better health. I can also add really quickly, we're a part of a Capital Resource Council. It's the part of the National Organization of State Offices of Rural Health. And they brought us together. They brought finance and they brought healthcare and public health together to actually have similar discussions of what we're having now, but over a 3-year period. And there's some resources happy to share, and maybe we can put in the chat as well. The Capital Resource Council has a website that has just a bunch of additional resources of working with CDFIs and financing. But that's a little bit background. We've done quite a bit with healthcare systems and public health. But I guess I'll leave it at that. We can get into more.
Great, thanks for that background and foundation. And it strikes me as, we think about funding rural health efforts, and I think CDFIs are perhaps one of those sources and a key partner that maybe we don't think about, but are by definition committed to supporting their communities and seeing their communities thrive, and specifically supporting those that, for whatever reason, are not having that access to those resources through other means. And I think there's probably several examples of that. One that I comes to mind is perhaps it's a social determinant area. We talk about childcare. Perhaps a childcare business is trying to get started, and for whatever reason struggling to access the financial resources to do that. With some partners, with some support, with the technical assistance, with the relationship with the partners you all have, a CDFI can be that really valuable partner that provides both the funding, but also the support, the technical assistance to get that going. Do you have any other specific examples like that where you can say, here's a space where something that we know is important to health and well-being in rural communities, issues that they're wrestling with, where we can see, oh, here's a CDFI stepping in, or you all stepping in and being that support?
Great question. And yeah, there are so many examples. We do have I'll just note, a childcare team really focused on that. We have at LISC, there's 7 national programs, and health is one of those, childcare. We've got safety, sustainability, economic development are a few. But to your question, um, LISC not only offers technical assistance, but also we're a convener. Reach out to us early in the thought process, early in the planning. And I can give a couple examples. We had a new hospital in rural Oregon reach out to us. They were having challenges with recruiting because there wasn't enough housing in the area, and they've had a group of nurses that had a significant commute. I want to say it was over an hour. And so they reached out to us just to, learn more. How could they encourage their community to build more housing? And so we were able to just take a couple hours and brainstorm ideas. We learned that they had a significant amount of land. And while they didn't want to be the builders and they didn't want to necessarily be landlords, how could they work with local builders? How could they lease the land? What other activities in the community were happening? Who else could they bring in to partner? And then the conversation did actually lead, which is what it sparked the thought, to childcare, because that was kind of the next on the list of recruiting. Having a place, which is often a challenge in healthcare, is you have shift workers, and so a 9 to 5 childcare doesn't always work, and so they were also exploring that idea. And that's one example. Another example is another health system in rural Northern California reached out. It was an FQHC. They had, an older building. They needed to update that building, but also they wanted to expand. So a capital project. So we were able to sit down with them again for a couple hours and just review what is their project plan, give them some pointers on, if this was presented to us, where we would see it, and the potential for lending, and give them additional advice and things to think about, but also talk through their capital stack. So capital stack, which was new to me when I joined LISC, is just the different capital, the different funding sources that could be available. So it's not just a loan. It could be public, it could be private funding, it could be tax credits, it could be any number of those things stacking up to get to the ultimate goal of what their number is. And so those are just kind of beginning stages, but then of course we have had several large funds contributing by both private and public partners that really develop out FQHCs, for example, and the fund was focused on bringing in housing and supportive housing near healthcare centers. So I want to say, I can't remember how many states were involved. At least 7 different health systems over about 6-year period, really focusing in on the housing in their areas, are a few examples. I can also add that we just posted a joint story with the Healthcare Anchor Network with Han. If your listeners are familiar, if not, definitely check them out. But we've been a longtime partner. They've got about 75 members, and we've worked with about 18 of them over the years. And we've just posted a blog story on Monday that highlights CDFIs, LISC, and working on housing. And these are all supported through Healthcare Anchor Network partnerships. So I encourage to reach out, or there it is, posted in the chat. If you're curious to learn a little bit more, there's examples all over the country, and it ranges from pre-development, so just trying to figure out and see the viability of either rehabbing a housing space or just a complete development, to modular housing, and then that supportive housing and mixed use as well. Yeah, there's some great examples. And next Monday, we'll post additional story really highlighting the economic development partnerships we have with over the years with healthcare systems.
Thanks for sharing that example. And yes, it is in chat, and that's a good reminder to me. If you have questions, folks in the room, you can add them in chat. You can also add them to Q&A, and we'll pull them into the conversation. And thanks for those examples of ways that LISC is supporting some of this work. It makes me think about something I saw, how LISC describes its mission. And it says that it's built on a premise that government, foundations, and for-profit companies have the capital. Residents and local institutions understand the need, and LISC helps bridge the gap. And we're going to spend more time talking than we have been talking about bridging the gap and the ways you're doing that. And I think if we think about those first two pieces, a lot of us probably, to varying degrees, agree that there are resources out there. There are governments, there are foundations, or entities, companies that have resources that can support this work, and would agree with the second piece of that a lot of rural communities and urban communities, but especially talking today, rural communities really know their needs, and they know they have ideas, they know what they want to prioritize to make their communities healthier and see them thrive. But so it makes me wonder, in theory, those rural leaders could just go straight to the capital, right? Go straight to the resources. So why do we need, and why are you all so valuable being an intermediary, facilitating that access? Because in theory, they could just go straight to it.
Yeah, great question. And just what you said, LISC is an intermediary. So we pool resources from multiple sources. So we're able to, in the example of the housing that I was touching on earlier, it's not usually just one source. We're able to pool public and private dollars together, and often use that as leverage to then bring in additional funds that might not have been available if it was a single entity making that request. We're able to leverage millions, sometimes for billions, so to speak. And the other part of the resources that we are able to help with is our partnerships. So Rule has, oh gosh, I think it's a little over 150 partners across the country. Or sorry, yeah. Nadia would know exactly how many, but active partners. And we're able to bring them together regularly throughout the year. In fact, that's where Nadia is right now, or on her way to bringing together these partners, because what we have found over the years is really being in community, having discussions, learning what has working or what is not working, or learning from others has been as beneficial and as rich as the capital itself. And attaching that to the grants we do and to the work we do, it's never in a silo alone. And also trying to connect people. So, I mentioned some of the health centers in rural Oregon and California, and hearing they both have similar challenges, or say rural Indiana, and bringing those folks together to really talk through, learn from, share information. So there's that piece of it. The other value is convening, but also adding the technical assistance. So it's not just sending out or granting out funding and then getting a report every few months or a year, but actually attaching technical assistance, um, capital assistance, of course. Um, what I'm thinking about right now is, over the years, LISC has done this, but we've more formalized it with the CCI model, the community-centered economic inclusion model. We worked with Brookings to really develop this out over the last couple of years. But it's really a model that is community-centered, community-focused. LISC has 37 local offices across the country. The vast majority, we were invited into those communities. We were asked to help support those areas, and very much to today, if there is a community need and they reach out to us, this model helps not only fund the conversations to create an agenda, to create the next steps, because sometimes that part of the funding is a barrier. And then after that agenda is set, after those priorities are set, issuing additional capital or finding additional resources that the community can then fundraise around or bring in private funds or public funds to really support. The CCI work, a significant amount of it has actually been funded by healthcare organizations, realizing that economic development and community development is definitely a part of health and healthcare and resources. So I can share a few examples. So in Georgia, there's a mixed use building that was developed, both apartments at affordable housing rates, but then the main level is retail, including restaurants and food market. But then the top is actually garden. They have a resident farmer, and creating a whole ecosystem within that space is one example. Another in the Maryland area is taking vacant lots and finding purposes for them, including establishing a regular farmers market. And as we know that there's a lot of food deserts, even in urban areas. So some of this funding has also supported urban gardens, not just establishing an urban garden in a community, but also having different community-led trainings and workshops on how to grow in your own, your own backyard, your front yard, container gardens, that sort of thing. I know I kind of went down some different paths there.
Something I'm hearing that I think sounds like it's a great ability and aspect of your work that enables a lot of this is some flexibility to bring different sectors together, to, we say it often, but to really meet a community exactly where they are and design your support, design how you find those resources and activate those resources to what they have in a community. And I think about how oftentimes we fund rural health efforts or fund rural social determinants of health efforts. It's often a grant out there, and this is not to say that these are bad, but there are challenges that come with a grant for a specific purpose for a specific type of grantee. And if a rural community, for whatever reason, doesn't have that type of resources together, that can be a really challenging thing to bring into a community, even if that need is identified and they know how they could use that support. So maybe talk a little bit more about the importance of, especially in a rural context, being able to do that really thoughtful and intentional cross-sector braiding, not only braiding different types of financial support and instruments, but also braiding different entities, different sectors, all around a common purpose.
I actually started my tenure at LISC on the rule team under Nadia's leadership, so I can speak to a little bit of that and some examples. Um, so LISC has been around for since 1979, 1980, and many of those offices I mentioned, invited us in, and we've been there for many years because, as with health, it can take years to see change, and we in rural communities especially understand that being in temporarily is often not the best situation, but really being committed to that community and committed to you know committed to make a difference over the long term. Um, I'm smiling because my work in advocacy, um, it I equate it sometimes to popping popcorn, and I feel like community development, um, bear with me on this, is somewhat similar in that, sometimes it takes a little while to find the parts and pieces and gather the ideas, but then once things kind of start getting heated up, and those ideas start happening, things start you start seeing progress, people get really excited. I feel like advocates get really excited. Communities can get really excited, and that sparks kind of the next, like, what are we going to do next? And so oftentimes when we've come in to support a community, they see some results and then they get excited. What can we do next? Who else can we work with next? Um, it reminds me of, oftentimes we start in housing because that's just the longevity of LISC has been so much in housing. But we realize, broadband is needed. Broadband can support not just the healthcare access, but the workforce. So then it sparks, oh, maybe we get employers involved, and maybe we do get it's schools and education involved, and then it kind of sparks further. And I think that's also why LISC does have a pretty wide breadth of activities and programs we work with, because communities have said, we need help with this. How do we do this? Can you help with this? And so we've adapted and added, I mentioned the child care work, but we've also added the broadband and disaster relief and services. It's I would say LISC has evolved along with communities and the community needs. And I guess I shouldn't equate it to popping popcorn, but there's an excitement there that once things get started in communities, um, I'll add another story, I guess, in Washington State. Um, the community put together an agenda, and part of that was affordable housing. And they had a they've had an immense amount of growth happening in their community. And while they have more affordable housing than other areas, they wanted to sustain it, to keep it. And so they had to organize advocates to go to the city council, and not once, but twice, to really share their stories and explain that they want to live near where they work. They want to stay in that community. They want to keep that community's culture as rich, as intact as possible, and affordable housing is a part of that. And they were able to get that message across to the city council, and who changed how they were looking at developing their community, which goes back to the community put together these agendas and this focus, and then they were able to really rally around that. We're actually highlighting one of those community members next month in a portrait of impact. So yeah, those are some examples.
The analogy of popcorn uh, just makes me think, when I make popcorn, I make it in a microwave, and it feels like for the first minute or so, nothing's happening. And you're like waiting for something to start popping, and then you get one, and then you get a couple more, and then you get three or four, and then all of a sudden it's this the bags filling up. And I think that is a really clever analogy or metaphor for thinking about this work, and that uh, we sometimes maybe want to jump to funding or finding resources for that end result, but sometimes we also need committed involvement and resources often to fund that work and that effort and that collaboration over the long term, and stays committed long enough for the kernels to start popping. And then that momentum builds and builds from there, and others join in. And popcorn also happens to be a good segue to something that we have going on here in Kansas, that I noticed on your work, some work in healthy food access. And, we're fortunate here in state to have some really stellar philanthropic organizations. And I'm not going to name all of them, but a lot of them doing really great, tremendous work to mobilize resources and activate collaborations, just like you all are doing. One of those organizations is a Kansas Health Foundation, and they worked closely with state and community partners to identify hunger and food insecurity as a major challenge for the state. And there is a great irony to a state that has agriculture and growing food and producing food so ingrained in its identity, that we do have real challenges with access to food. And it's a one of those complicated, multifaceted challenges that cuts across a variety of sectors that a lot of groups have a stake in, and does impact health and well-being. And it strikes me as one of those areas where well thought out investments, well thought out access to resources in people and businesses can have really wide ranging ripple effects through a community. I think about, to use one example, one rural grocery store in a community that's an hour from a town of big size, like my hometown, Ness City. If we lost our grocery store, the closest grocery store is at least, 30 minutes away, likely. And keeping that grocery store going is a really tremendous asset in a variety of ways to a community. And you all have been working in food access. So tell me a little bit more about how you think about food access and how you're approaching some of those investments and supporting access to healthy food.
On a personal note, I can totally relate. The little town in Indiana I grew up in, we had one grocery store for the county, a two stoplight, in the county um, kind of rural area, and yeah, driving 30 minutes to an hour, can totally relate to that. As far as food access, it can be complicated, and it has become more challenging for all kinds of reasons. And the irony of living in a state where so much food is harvested, and yet there are challenges. Very relatable. The work that LISC does in the food space, it ranges. Just like I've said earlier, we range from doing lending and loans to support grocery stores. We've done grants to support developing farmers markets, or helping increase the marketing of those farmers markets, to small businesses that are working to package their goods and enter into the retail space. Um, I mentioned earlier urban farms and gardens. And then, I mentioned earlier that rooftop farm garden, that mixed use apartment residence in Atlanta. But over the last few years, at least the LISC Health team that I sit on has supported Healthy Food Access Grant Program, and with various funding. And that's really focused on capacity building. A lot of the work over the last few years has really been in the capacity space of food access. So, and capacity building can mean a number of things to a number of people and organizations. And so, mentioned earlier, LISC really tries to meet folks where they are. And so some of the grantees, they're needing to develop more land itself, to bring in more seed. But some are looking to develop their boards, their volunteer reach within the community. Others are looking to develop a food as medicine, food in a box, weekly distribution with the health FQHC. So it's really ranged in the capacity needs. Some are looking to be more integrated in the community, and so that's workshops or just bringing in more staff. And some are looking to we need more storage space. They need more building space to store equipment. And so the collaboration with LISC is, again, what are your needs and how can we fill that gap? But then also, could we use some of the lessons learned to leverage to help additional funds, either in the state or private, help those retailers or those farmers or those in the food access space develop that much further. We have another one that's actually has a urban garden, and they're actually developing a food pantry next to the garden to really support the food desert in their area. And others have food banks, but they need better access to the farms that are a little bit further out to be able to bring those goods in. So, the food ecosystems are often a challenge in so many places, and not all, one solution fits all. But those are some examples, and yeah, I think there's only going to be more and more need for food access in the coming months and years.
Something I'm hearing in all the great examples, is this wide range of approaches and variation, and it just strikes me that there can be, and there is, so much creativity and innovation that we can find in our community leaders and in our rural communities that are ready to dive in and do this work and have ideas or have the capacity to work in collaboration with others to come up with and act on those ideas. But at a certain point, they run into, Nadia's said this before, the expression of, if only I had X. There's this, I visually I can see it, standing at the edge of this cliff, and they can see where they want to get, they can see it clearly, but there's this gap, and if only they had something to get over that gap. And the first thing we often think about, and it is a very real need, is money or resources. But all the examples you're talking about really emphasize that oftentimes it's resources and something else. And the thing that comes with that and is just as important to have support for, whether it's the technical training and support on the back end things, whether it's just navigating different systems, whether it's doing some of the legal aspects of acquiring land or acquiring the permits, or all those things that are baked into getting these initiatives going. And LISC is in a position to support those. And I imagine other CDFIs are in a position to help bridge that gap, to think about that question. And they're a resource that maybe we have not thought about as often as we could. So I love all those examples and the emphasis on it is resources, but it's also that other support, and that other support is just as important. I am seeing a question in chat. Ask a question about a link for some more information. We will post some resources in our recap with the recording. But the second question, I think, is one that I think is a great question for you to wrestle with. A place we can start. So if Jessica, I don't know where Jessica's coming from, but if someone listening to this goes, we're one of those groups that would love to have this support, or to find our local CDFI or a group in our region that does support groups in Kansas? And there are some of those. Where do we start?
Great questions. My head is spinning a little bit to so many different ideas and things to touch on. Um, uh, I mean, the first that comes to mind, I mentioned the Capital Resource Council. They've got a whole bunch of resources on their website. But one of the things that when we came together in person as a cohort was, um, the I sit in the financial aspect of a CDFI, but my background is in the health world. And the one thing that so much of the finance folks on the council were saying was, you don't need an MBA. You don't need a finance background. You just need to know who and how to reach out to those like a CDFI, like LISC, that can help with that. And a lot of the challenges we learned of on the healthcare side was, I don't even know where to start. I need to, I need to know how to do a capital campaign. I need to know how to do all this myself. And I think some of um, the reassurance was that CDFIs are there to um, help you think through those things, help understand just the language and the jargon and all of the different new acronyms, some that we share but mean very different things. So I guess the first thought is to get curious about, as you said, who is in Kansas? Who are the CDFIs in your area? What work has been done? Like I said, we're putting out a couple of blog stories on just the highlights that the Healthcare Anchor Network partners have done with us. But there's a myriad of stories and examples, both on the LISC side, but other CDFIs as well. So I guess that's kind of the first thought I had. We also work with, and they're a part of the council as well, Build Healthier Places Network. They have a wealth of information about specifically CDFIs and healthcare as well. They've just put out a new, I think it's a report of sorts that really outlines, how to get started, what examples there are in the healthcare space. I mentioned FQHCs, but we have public health departments as well. But then those that are, public health adjacent or healthcare similar. Sorry, I just saw a question, got distracted. So those are a couple that initially come to mind. The other thing that Nadia talks about is, reaching out early with your thoughts or ideas. Bring in a CDFI. We're happy to say, right now I don't think this idea is ready for a loan, but here are the 3 steps that we would love to see to make this loan viable, and the possibilities, instead of getting so far down in the process and realizing that, oh, this might not be exactly something that we can support at the moment. And that could be pre-development, just trying to figure out, is this, land viable for what we might be interested in. The other thing is, there are so many community partners that Rural works with, and they host different convenings. And right now, I think she said there's like 7 or so convenings across the country, so really region-based. So I think I might have shared a link to that. You can see some of the dates and locations. Typically, the Rural team hosts one big convening a year, and every other year it's in DC, and the off year it's in a different rural locality. But this year they're doing smaller regional ones. So if there is one in your area, might get curious and reach out and see. I don't believe there is a registration fee, but there are a couple of also virtual ones. One just happened in August. I think you can maybe see the recording, but there is another one coming up, and I think a month or 2. So if that is of interest, you can get to know kind of the different work streams that role has, but then also the partners. And I think that's where so much of the real value is connecting with those that are similar to you. The one thing I will add, as I know we're getting closer on time, um, I work closely with the Colorado Public Health Association. We had our annual convening a week or so ago, and one of our keynotes, she said it is a challenging time right now, especially in public health, but healthcare. And she was getting a little down, which I feel like is a realistic feeling at the moment. But if not, if not you, who? And if not now, when? Um, I think there's so many possibilities to bring in partners that you wouldn't have even thought of. And she really encouraged the attendees, who are partners you haven't partnered with? Why not? Reach out. I think that's a little bit of what we're talking about today. CDFIs aren't maybe the top thought of a partnership in many realms, but why not?
You went right where my head was going, and Lindsay, note in chat, shared the link to the convenings. We do have one, or you all have one in our area in Kansas City coming up. So folks are welcome to check that out. I think we've spent a lot of time talking about CDFIs because LISC is a CDFI, but what I'm hearing is an invitation to think about resources and activating resources and partnerships. And one of the most valuable resources we have is people's time and attention and effort. And that's an important resource too that is available in rural communities, is being creative in how we think about who those potential partners are. And CDFIs are one of those partners. LISC is one of those partners. But those partners may look different in different rural communities, and not being afraid to lean into that creativity and that innovation, and have a partnership that you haven't seen before, but will work for your community. And we talk often about rural health leaders, rural health coalition leaders wearing many hats, like lots of hats. They have different roles. They, have lots of titles, official and unofficial. And our funding in rural health, our way that we pull together resources may be just as multifaceted. And in a lot of cases for our rural communities, it may not be one large grant or one large program. It may, with one entity, it may be a coalition of braided and layered efforts that help make that progress happen. And I think that's a great invitation to folks to reflect on what that looks like in their community, or among people in the audience that are in a position of that statewide association or group. How can that collaboration be facilitated? And so I really appreciate all the examples and the invitation to be creative. Kansas is in the midst of having our Public Health Association conference as well. And there's a lot of committed folks in our state that are looking to solve these challenges, and LISC and CDFIs can be a great resource for that. We are coming up on time. I'll give one final invitation to folks. If you have a question for Kjestine, something you've heard that struck you, please add that to chat or the Q&A to folks. If you have a question. Otherwise, as I watch for any of those, Kjestine, I'm wondering, and you've shared a little bit of this, but for those folks that are coming from healthcare, public health world, where this feels really foreign, talking about financing and loan agreements, or all just navigating these waters. sort of a one step further on the question of a place to start. Any advice for those that feel like this isn't my world? I'd love to try to lean into this, but it feels too foreign. Any advice to folks to take a step into that?
Yeah, I mean, I've been there. Um, the first thing that comes to mind is, I have a artistic design background, and passion. Um, the term in the design space is openness creates interaction. And that openness could be positive or negative, but just being um, open to the possibilities, and being really frank that I don't understand what a capital stack is. And my response is, that's fine. We've got information about that. You don't need to know it. We just want to know what are your gaps? What are your needs? What have you tried? And um, how can we get through those barriers or make those changes? And that's what we're here for, is to really help communities be the best places to live, work, play, do business. Um, but yeah, and openness creates an interaction. Um, it's the first thing that comes to mind. You mentioned something else, and now I was going to comment on it, but I feel like we're running low on time. But I don't know if there are any questions that came through, but this has been such a pleasure. Thank you so much.
Thank you. That openness creates interaction, and I the idea of being open to working with new partners, working with CDFIs as one of those potential new interactions, and it it makes me think that the your advice of being honest with this is new to me, but that's okay. We can work on it together, but not also losing sight of if I know there are people in our rural communities in Kansas that do have a lot of great skills and have a lot to bring to the table, and being leaning on that and bringing that with openness to a new interaction, a new collaboration can go a long way, and be part of all the different ways that we're all collectively trying to learn how we can create thriving rural communities. And uh, I'm really happy you were able to join us, Kjestine, and share your insights and share all the great examples about ways that you all at LISC are supporting this work and finding ways to leverage resources in innovative, creative ways to facilitate collaboration, to bridge the gap between the resources that are out there and the people in our communities that are ready and willing to use those to make an impact. Thank you all for being here, and Kjestine, thanks for joining us at our coffee table. Even though you're not a coffee person, I hope you had enjoyed the conversation as much as I did, and thanks for stopping by.